Dr. Ketterpaul.
Great. Thank you very much for that introduction. And thank you, Dr. Bergfeld, for giving us such a wonderful background on hair loss. So, Dr. Bergfeld and I have been very fortunate to work closely with Eclipse and to offer PRP to our patients, and also now have Votesse, which I think is a wonderful product that we're going to be discussing today. So let's talk about some of the key ingredients. So first off, Votesse, there's a men's formulation and a women's formulation. So this slide kind of covers the key ingredients that are in both, and then we'll go over some of the key differences between the women and men's formulation. So the first is your soluble keratin or cyanotin. So we'll talk about each one individually, but cyanotin is really important for giving our hair the strength it has, which is shown to decrease shedding. The polypodium leucotomos is an antioxidant that fights the effects of free radicals. We have Bacillus coagulans, which is a probiotic. As time goes on, we are finding that our skin and gut microbiome are really tied into our overall hair health. So giving a probiotic not only helps, your gut, but it's also shown to help the hair. We have other things that are anti-inflammatory like turmeric. This is, it helps with free radicals, decreases stress on the cells. And then niacin we have, which increases circulation and oxygen, which makes sure that all the nutrients are getting to your follicle. And, overall, this is just a really good multivitamin. And it's important to know that compared to some of the other products on the market, it does have higher concentrations of calcium and niacin when compared to them. But this includes, your daily doses of your vitamin A, your B vitamins, vitamin C, D, calcium, magnesium, and zinc. So not only is this a hair vitamin, but it's also a really good multivitamin. So it eliminates the need for patients to take multiple things. They kind of have everything in one for their overall well-being and also for their hair. So let's talk a little bit about one of the key ingredients, which is cyanotin. So cyanotin is our soluble keratin. It comes from New England sheep, and it has really shown to make the hair stronger. And you can see in this chart on the left here, looking at 30 days, there's a fairly significant reduction in the hair pull test, which continued to increase until day 90. So this is looking at baseline, or placebo, which is in gray, and then the cyanotin in black. So significant decrease in the hair pull test, and then clinically, patients will say they're having much less shedding, which is really nice to hear. And then looking at the amino acid profile of cyanotin compared to placebo, there was also an increase in that. So this is one of the key ingredients that patients will really feel happy. You can combine this with other procedures you're doing or other therapies, like Dr. Bergfeld mentioned. But tell them it'll take several months to see the full effect. But as soon as month 1, they can start to see a decrease in shedding. It's also important to know that some of the competitor products have shark and marine collagen. So this is a different source of keratin, and it's not taken from sharks or any marine collagen, but once again from New England sheep. So slightly different than the other products on the market. Next. So let's talk about the men's formulation. So these are the ingredients that are just going to be found in the men's formulation. So the first is saw palmetto, which is an herbal medication that has shown to decrease 5-alpha reductase. This is really important because this is the enzyme that converts testosterone to dihydrotestosterone, which is its stronger counterpart on the level of the hair follicle. And we know that drives AGA and hair loss, specifically in men. There's also pine-derived phytosterols. These are anti-androgens that have been used for benign prostatic hypertrophy or BPH, but also have some anti-androgen effect. Then we have our green tea leaf extract. This is shown to decrease inflammation. It's an antioxidant and reduces stress, also by being a free radical scavenger. Then our nettle leaf extract. This is, a natural alternative to linoleic acid and omega-3, which are both antioxidants and have anti-inflammatory effect. So a lot of omega-3s come from animal sources, but this is a natural non-animal derived source. And then we have our pumpkin seed concentrate. This also reduces dihydrotestosterone, like our saw palmetto, and it also is an antioxidant working on free radicals. So each bottle has a 1 month supply of 120 pills, and it's meant to be taken 2 tablets twice a day, so 4 tablets in total, so 2 in the morning, 2 at night. And this is unique to our men's strength. So next we'll talk a little bit about our women's blend. So the women's Formulation is slightly different. Some of the key ingredients are our ashwagandha root extract. So this acts as an adaptogen. It has many antioxidant properties, and it's a natural ingredient that reduces cortisol. So we know that cortisol is one of our stress hormones, and in women, we know that hair loss is influenced by cortisol. So by decreasing that, it's going to help with inflammation and optimize hair growth. We also have flaxseed elements as a natural non-animal source of omega-3. And then L-tyrosine also decreases stress and works as an antioxidant. And then our velvet bean extract. This is an antioxidant that protects against UV radiation. It is an Ayurvedic medication, and it has some neuroprotective effects. So not only is it anti-inflammatory, but it also has some effect against UV radiation. This bottle also is a 1 month supply, taken the same way as the men's formulation, 2 tablets in the morning and 2 at night. So next we'll talk about the foam. So each of the men and women's formulation is paired with a topical hair foam, which is the same in both. This is really unique. We'll talk about the ingredients that it has, but we know that, this foam, it's not greasy at all. When applied to the scalp, it really has, different vitamins and nutrients that can be used in any patient type with any hair type or texture. So it definitely hydrates the scalp. It can get these nutrients to the cortex. Patients will report that their hair looks and feels better. It has more moisture, and it's just going to be an overall great product for the scalp. So some of the key ingredients in this foam, the first is, next slide, please. The first is Redensil. So this 3% Redensil is a really key ingredient because it's an anagen activator. So we know from Dr. Bergfeld's introduction, there are other topicals that can be used, but this is totally drug-free. We know it also decreases apoptosis. So eventually we'll look at some studies showing how it decreases telogen, but we know that a lot of the hairs are shifted from telogen to anagen, and anagen, which is our growth phase, you're going to push more of those hairs into the growth phase. So you'll have less shedding, more hair growth. It also contains caffeine, which decreases dihydrotestosterone, one of our potent androgens, and increases circulation. It has Serenoa fruit extract, which is also a 5-alpha reductase inhibitor, and then this Panax ginseng extract, which suppresses apoptosis, which is programmed cell death. So you're going to keep the hairs healthy, and many of them will be in the growth phase. So next we'll look at a study where it looks like the anagen phase activator. So this study was looking at the number of hairs in each phase. So if you remember that anagen is in your growth phase and then telogen is your shedding phase. So after 3 months, there was an increase of 9% anagen hair. So this was using the Redensil 3% compared to placebo. So there was an increase in the number of growing hairs. And then the lower graph shows that there was a reduction in telogen, which are the shedding hair. So a 17% reduction in telogen and a 9% increase in anagen. So you're really getting all those hairs into the growth phase. So clinically, patients will have less shedding, and then you will visibly be able to see more hair growth, as you can see in these photos on the right. Next. So overall, these are the ingredients in each of the supplements, in the women's and the men's. You can see that it has, a multivitamin. You have your vitamin A, C, D, and E, in addition to other things, in addition to, your probiotic and all these other ingredients that are key to for hair health. So it serves as your multivitamin in addition to your hair vitamin. So patients can oftentimes get overwhelmed when they're taking multiple things. So everything is included in their hair health supplement. Looking at polypodium. So polypodium is an antioxidant that we know helps fight the effects of free radicals. It's also anti-ultraviolet light and an antioxidant. So we know that it can help not only some things in the skin, but also in the hair, which is why we included it. Next. And then looking more at the microbiome. So as time has gone on, we've looked at the gut microbiome and in those with hair loss. So, there's been a lot of talk about the skin microbiome, but what about the microbiome? So Bacillus coagulans is a probiotic, and this was, included to show that by including this, that there's an improvement in overall gut health. And on the next slide, we'll see that we know the gut health really ties in specifically to the hair. So this paper looked at the difference in the the gut microbiome in alopecia areata patients compared to their control. So we know that, once you normalize that gut microbiome and kind of balance that good and bad bacteria, that will influence the hair. So it's good to repopulate the gut. It's also biotin free. So, the FDA did issue a warning that, biotin may interfere with some lab tests. So, things like a thyroid function test, troponins, you have to be really careful if you're on biotin. So these supplements are biotin free. There hasn't been a lot of scientific evidence that biotin improves hair health unless someone is deficient in biotin. So the risk of interfering with these is, why we chose not to have biotin. So know that, patients don't need to hold their supplement if they're getting any kind of lab work done. And then just overall looking at our women's strength Votesse compared to our competitors. So, what like we talked about, this is biotin free. It does have higher levels of niacin and calcium compared to our competitors. It is not derived from shark cartilage or any marine collagen. As Michael had mentioned before, this isn't something that patients are just going to go online and buy themselves. They're going to get it from your practice so they know the source that it's getting from. They know it's authentic. And it includes your probiotic, your polypodium, which is your antioxidant, and your daily vitamin in both the male and female formulas. And then each of them have other antioxidants and other anti-inflammatory ingredients to essentially give your patients, the best overall, health, not only for their hair, but also just overall well-being. So it's important that, if you have patients who are pregnant or breastfeeding and any other medical conditions, that they consult with their physicians before starting Votesse. So that's something, if it comes up, if you feel comfortable making that recommendation, or for any pregnant or breastfeeding patients, maybe have them discuss it with their OBs, just so they know what the ingredients are and if they're comfortable with them taking it. Next. So briefly, I'm just going to talk about a study that is looking at Votesse for 4 months, the evaluation of hair growth in men and women. It's 25 patients. The topical Redensil was used once a day, and the supplement was taken as prescribed, which is 2 tablets in the morning, 2 at night, so 4 in total. And the primary endpoint was looking at the hair density, which is measured in a certain area at 4 months. And then the secondary efficacy and endpoint was looking at a patient satisfaction questionnaire. So, for the investigator questionnaires, 93% of them said they had improvement looking at the hair growth global improvement. And then the hair quality improvement, 94% were reported to have improvement. And then we'll look at some photos also. So the trichoscience was able to measure the change in density, and then global photography was taken at visits 1, 3, and 5. So this is just one example before and then after 4 weeks. You can see the improvement in the hair density with this combination of the foam and the supplement. So we're seeing really great results. And, after 4 weeks, the results are, continuing to get better. So as we have more data, we will share this with you from our study. So just in summary, we have some early study data and, anecdotal evidence from our clinic and from my patients that are showing the efficacy with Votesse. It is well tolerated by our patients with minimal side effects. Very few to no patients are reporting any irritation from the topical. They're not having any, GI side effects or anything with the oral medication. There's a long list of proven ingredients for hair health, and it's a nice complementary solution to give in-office procedures, when you're doing PRP, things like that. And you can create value for your patients, especially during this time where, they may not be coming into your office as often as you'd like or they'd like. This is something they can do at home that's going to maintain the improvement they have and just continue to get better. And we know hair loss really affects the quality of life in both men and women. So this is something that can help achieve those results at home when your patients start to see less shedding. And, they're just going to feel better about their hair, and then you can just complement it with procedures doing in your office. So with that, thank you very much. And I'm going to turn it back over to Michael.